Hello and welcome to Ageless Beauty broadcast. I'm Dr. UMERAH and I'm here at our sister location in Columbus, Georgia, um, Rivertown Wellness, and we are going to be talking about acne. And of course, I'm here with my lead esthetician, Christina. Christina, we've all been vaccinated, so you don't need to wear a mask so everyone can see your pretty lips that I created. But yeah, today we're going to be talking about acne and acne scars, okay? So welcome everyone. It's Mother's Day weekend coming up. And so we're here celebrating it at our sister location in Columbus, Georgia. So feel free to call, DM us, actually DM us. We want you guys to DM us. We're going to be talking about acne and acne scars, okay? And feel free to drop in. Feel free if you're in the Columbus area. We're actually serving some drinks and some stuff around here. So can you say hello, Christina, and just say something to our audience?
Hi, everyone. It's good to have you here today.
Okay. And what?
And let's talk about acne.
So acne, what is acne? So acne, okay, some people are making me laugh around here, but don't make me laugh. So acne is a skin condition that occurs when your hair follicles become plugged with sebum or oil, or maybe with dead skin cells, and it occurs most commonly amongst teenagers. But anybody can have it, even in any time in their lifetime, depending on what is going on in their lives. And also, we can have what is called adult acne. Okay, so today we're going to be talking about how this is affecting us, what we can do to treat it, what treatments are available, and things like that. So, depending on the severity, okay, it can cause some emotional turmoil for some people, especially teenagers. Their self-esteem and everything. What can you think about that?
No, that's true. Let's see.
Okay, so I'm gonna help you out here. I'm gonna help you out here. So there are different kinds of acne. So the common acne, which is called acne vulgaris, is one of the acne. We have cystic acne, we have nodular acne. So the signs, depending on what you have going on, it could be from whiteheads, which is clogged pores. It could be the blackheads, and it could be small tender forms called pimples. So acne can also be zits. Some people call it zits, some people call it spots. Things like that. So these are the different kind of acne. And feel free to have, if you have any questions, to DM us. I think we have a question coming up. Is there a question? So what is Zitera doing? Zitera, you're blocking my flow. You're blocking my flow. Okay. So, so the different kinds of acne, which ones have you seen lately? Most commonly, especially
most commonly, I see a lot of blackheads or comedones is what they're referred to as. Now, when it gets to the point where there's actual pus or infection in it, that means bacteria has been introduced to it, and it's actively infected.
Yeah.
So those definitely need to be extracted. There is a proper way to do that, and I definitely recommend you coming and seeing a professional to have it done. If done improperly and you're, picking yourself, you can introduce more bacteria to the skin, and it can spread to other areas of the face.
Okay. So different causes of acne. So it can go from like the whiteheads or the blackheads. The blackheads, they look like seeds on top of your skin, and then the whiteheads, and of course the nodular acne and the cystic acne, whereby the pores are actually clogged with dead skin cells and gets infected, and it causes, it's very painful. So those are the types of acne. And of course, there are different consequences in different consequences. It can cause scarring, it can cause hyperpigmentation. It can be very, very painful. So those are the things that that we see, the aftermath of acne. So four main factors that cause acne is excess oil, sebum production, It could be hair follicles being clogged from dead skin. It could be from bacteria. It could be from inflammation. So acne is not caused by not washing your face and stuff like that. It can also be genetic as well, as we know that. You said what?
Like hormonal.
Yeah. Acne can also be hormonal. Um, so when you have hormonal imbalance, especially when we get older, um, and we have hormonal imbalance, that's what we call now adult acne. Also, there's something called the new term now, masking. Can you explain to the audience what that?
That's typically what I've seen a lot of since COVID's been introduced to us. The aftermath of wearing a mask all day long. I get a lot of clients that have it on their neck, lower jaw, around the mouth area, typically any part of the face that's covered by your mask.
Yes. So let's go into the treatments, okay? So we're gonna go into treatments. So number one treatment is using the retinoids, okay? So that could be tretinoin, and you can have it in the different gel, the different cream. You can have Tazarac, things like that. So the retinoids are my number one to go, and you normally use it at night. Okay. It can cause skin sensitivity to sun, so you have to wear sunscreen, and that's why we always recommend sunscreen, sunscreen, and sunscreen.
And I would add too, with the sunscreen, if you are experiencing acne, the best type of sunscreen would be a mineral-based sunscreen, something that's based with zinc oxide. That's actually, zinc can actually help clear up some acne. So I would definitely recommend a zinc oxide-based sunblock for the skin.
So my number two treatment is antibiotics, and we use different kind of antibiotics. So I'm talking about non-topical antibiotics like benzoyl peroxide, clindamycin. Um, Normally, we don't do antibiotics by itself. We want to combine it with benzoyl peroxide. Um, that that is really recommended. Okay, and we have oral antibiotics, and that can go from erythromycin. Um, we use macrolides. I don't want to go very technical on this, but we can use doxycycline. That can be used. And antibiotics, you don't want to use it for a prolonged period of time. You want to do it anywhere from 3 to 6 months in order not to create what is called tolerance. You can also use tetracycline, minocycline, things like that. Now, combined oral contraceptives are also good, especially if for women that are looking for contraception, this would be a good way to go. There are about 4 that is FDA approved, and I'll tell you things like orthotricycline or the Yaz. Have you seen that lately?
No, I haven't.
Okay, so those are one of the one of the treatments that we can use using oral contraceptives. Now, anti-androgenic agents like spironolactone, aldactone is also good, especially for adolescent girls, and people that don't want to use antibiotics or are allergic to antibiotics. You can use spironolactone. So that's very good. Now, let's talk about other treatments. Now, with acne, because sometimes it can be very, very resilient to treatment, you don't treat it in one specific way. You have to target it in areas. So you can use topical antibiotics, you can use oral antibiotics. Can you turn this thing on? Oral antibiotics, and you can also use other modalities. So let's talk about light therapy. As an esthetician with Ageless Aesthetics, yes, we're in Rivertown Wellness. What can you tell us about light therapy? What kind of light therapies do you use to treat our clients?
It would be a blue light therapy, and blue light therapy can actually penetrate the skin into the pores and kill the bacteria. So blue light therapy is a really great option to help clear up some active acne that you may have on the skin.
Okay. Do we have any questions? Okay. So We can use the light therapy, use the blue light therapy. There's also, what about the IPLs?
IPM, it can be good as well to help clear up acne. A 1540 laser treatment can be very good at clearing up acne. Uh, those are two treatments that we can offer at our location. Let's see what else.
Oh, there's so many things.
There's so many things.
So many things. But let's just start with the light therapy. So there's the blue light therapy, and then there's the IPLs. Okay, so we have chemical pills. We have different kinds of pills. We have the light pills, and we have the medium and the
more aggressive medium depth pills. Yes.
Pills. So chemical pills could be anything from salicylic acid, glycolic acid, lactic acid. But for acne specifically, we're looking at salicylic acid and glycolic acid. And actually, so it takes up the top layer of your skin. It helps to kill the bacteria. It helps to give you a smoother skin, but you will actually peel. Okay. We have drainage and extractions, which you do. And how do you accomplish that?
But for extractions?
Yeah.
Well, I would typically have someone come in. We would do a facial. We could do a hydrofacial. We could do a traditional facial, but the key really is to prep the skin before extractions can be done, because it's much easier to get that bacteria and get all of the sebum out of the skin when the pores have been properly prepped to make them come out much easier.
That's good. And then there's also the steroid injection, which has to be done by a medical provider. So with nodular and cystic acne, the results are really amazing. Okay, so the nodular acne, you actually feel the bumps under your skin. Those can be injected with a steroid. But there are also side effects like thinning of the skin and discoloration. That's why you have to go to a licensed provider to get this done. Now, at Ageless Aesthetics, what do we do for acne? Let me just run down the list, and then we can talk about them one after the other. Okay, so the treatments that we do at Ageless Aesthetics are the microdermabrasion, hydrofacials using the LED light therapy and extractions, chemical peels. We do the laser treatments. We do the IPLs and the profractional laser treatments. The profractional laser treatments are actually very good for all skin types. So it's not limited to any skin type. We also do what is called the fractura treatment, which is microneedling with radio frequency energy. And we do the traditional microneedling, we just microneedling. We can use it with your own blood, which is a PRP, or we can use it with hyaluronic acid or whatever Christina thinks that is necessary. It's good for your skin. Now, we also do fillers. So the only FDA-approved filler for acne scarring is the Bellafill. Okay, and of course, we offer skincare treatment. So let's run down the list again. Microdermabrasion, which is
exfoliation, a mechanical form of exfoliation where there's some crystals that are put onto the skin with a vacuum to help polish and pull away the dead skin.
Good. So, like I said, in case anybody just joined us, we're talking about treatments of acne, what we do here at Ageless. So microdermabrasion, I call it sandblasting of the face. So you're kind of like using crystals to kind of buff up the dead skin, whereby that will help open up your pores and help your products to penetrate. We also offer the hydrofacials, which the 3-step therapy. Can you just run through it real quick?
Yes, so we do 2 forms of exfoliation. There is a wet dermabrasion, similar to a microdermabrasion, however, it's done with a solution versus a crystal. And then we will add some salicylic and glycolic acid to be able to penetrate deep into the pores to soften anything that's in the pores. And then we come back through with vacuum, and we do a vacuum extraction on the skin to help remove all of that buildup that's in the skin.
Yes, and we recommend it for all skin types, especially for adolescents, teenagers that don't want to take, don't want to do oral antibiotics and don't want to put any harsh chemicals on their face. So this is very hydrating, and you know, it's very good. Now the chemical peels range from mild, medium to more aggressive peels, and we have a whole array of peels that we can do. So acne can be treated, okay, but it's not one hat fits all. Um, you have to hit it in different ways. And of course, the fractura, which is the micro needling radio frequency energy. Um, for people with more severe acne, I really recommend that. There's no point wasting time on microdermabrasion when you can do a micro needling treatment. It penetrates deeper. It helps to promote collagenesis, collagen synthesis. Um, it helps to kind of resurface the skin, giving you um, a smoother skin. Would you add anything to the micro?
I would also say keep in mind that that is a great treatment for acne scarring, but it's also okay for someone with active acne to have that because it can actually help clear up the acne that's on the skin.
Okay. So I would recommend you getting the fractura, but also getting the chemical peels, because the chemical peels like the glycolates and the salicylates actually help to kill the bacteria. So you don't hit acne with one specific, okay, so I'm going to just take antibiotics and be done with it. No, you have to do other things. So if you're taking oral antibiotics, I'll recommend you have a skincare also that you use, the retinols, okay? That is very good. The salicylic acid, that's very good. And of course, get a good moisturizer. And of course, you have to always have what? Sunblock. Okay, thank you everyone for watching. Like I said, we're here at Rivertown Wellness, our sister location, and we're having our Mother's Day event. Feel free to DM us if you have any questions. Feel free to ask. We'll always return back to you. And our phone number is area code 478-333-2595. And our Facebook page is Ageless Aesthetics WR. Make sure you add the WR.
Bye everyone.